once I validate this note, I'm going to validate this note right here, as you see, because I like the note that's there and it describes everything we did. And the note is now validated. We can come down to the coding of this. Now, complexity, it says low, risk is moderate. The MDM part of this says it's a 99213, based on basically she's overweight and the fact that she wants counseling on procreation. And even with all these ICD-10 codes, we only get an MDM of 99213. The most important thing is you don't necessarily have to check this one because the time-based CPT is a 99215. And because of the recording, we verified that we spent 55.31 seconds, 55 minutes, 31 seconds on this visit. Okay? 40 and a half minutes were spent face-to-face, another 15 minutes as far as reviewing her old documentation, her new documentation, and her lab work. If you combine all that, it creates a time-based CPT code, which is 99215. So most coders would have come in and just used the 99213 when actually you spent almost 1 hour with this patient, and you can now import this code and all her diagnoses that go with this. I need a warm finger. Okay. With that, so instead of checking this code, we're going to check this code because this is actually more realistic about the time that I spent with her, 55 minutes and 30 seconds. And once I do that, I'll hit validate the coding report.